Hello, and welcome to That Girl Magic, the podcast where we explore the transformative power of wellness, self improvement, and magic. I am your host, Karina Franco, and I'm thrilled to embark on this journey of discovery with you.
Hello, welcome back. So, I'm going to be very honest. This is going to be quick, easy, and informational. I'm not sure how long this is going to be, but from my calculations, probably going to be a short one. But to be honest, we like a good short and sweet. So, let us go ahead and let's get ourselves started. So, we're going to talk about skincare and your skin type in particular. A lot of people have a really hard time figuring out what is their skin type, what can they do to help it. So, I wanted to do a quick and easy situation to help you get started. So, first of all, let's make sure one thing. Sometimes we have different skin types depending of our face to our body and even times of the year, especially if you have combination skin, and we'll get into that a little later what it is. But combination skin can mean either normal to oily, normal to dry, mostly oily, mostly dry, or kind of in between. And you could also have added to certain other skin types, also skin conditions. So we're going to talk about skin types and then we're going to go into skin conditions, okay? So when it comes to skin types, there is the dry skin type. So normally dry skin type, you're going to notice that your skin may feel tight after washing. You may feel like you have a dull appearance. You could have flaky patches on your skin. Normally, dry skin is more prone to fine lines and wrinkles. You can feel a little itchier. And also, people tend to notice it very quickly because you have really small pores. You don't really produce oil. So, for example, if you do your makeup and you put just your foundation, you don't put any powders on it, you may feel like it looks the same throughout the whole day. Meanwhile, someone with an oily or combination oily skin type, um, they will feel like if they don't put any powder on or use a matte foundation, they will be like a grease ball at the end of the day. So when it comes to dry skin, what dermatologists tend to suggest is non-abrasive cleansers, stuff like cleansing oils, cleansing balms, not really towards the foaming and the exfoliating that often, even though you should use some sort of form of exfoliation, but go for something more like chemical exfoliation with something like a lactic acid or glycolic acid, something a little bit more tame, something that you can use more often at a lower dose. Also, very rich moisturizing products, stuff like masks, moisturizers, um, something that has a bit more humectants to it. Also, when it comes to serums, going for something like vitamin C and hyaluronic acid. Vitamin C is going to help with the dullness of your skin, and also the hyaluronic acid is going to help pull moisture. So something really cool is that if you have a moisturizer that is um, very water based, and then you before you add the hyaluronic acid, the cool thing about it is that it's going to draw out the moisture of the moisturizer onto your face. And let me make this clear: no matter what skin you got, SPF daily. Okay. I don't care. You gotta use SPF no matter what. So, regardless of the skin type that I say today, you gotta use SPF. Onto oily skin. So, if you have oily skin, normally you'll notice that your T zone, your cheeks have a very shiny appearance. You're gonna notice enlarged pores. Normally, oily skin also tends to break out more easily, and also because you tend to produce more high sebum production, you normally tend to have very minimal fine lines. If you actually go ahead and compare um, ethnicities, some ethnicities are more prone to a particular skin type than others. Um, so, for example, a lot of Asian people, so Asian based heritage people, will tend to have slightly more drier skin, which is why if you go and look at Japanese skincare, Korean skincare, they all have a lot of ingredients focused on hydrating your skin, so giving water to the skin, no matter the skin type. Meanwhile, if you look at a lot of African based skincare, even for body, they're very focused on a lot of butters, a lot of nutrition to the skin. Because normally, be aware, I'm saying normally, not always, they tend to have a slightly more oilier skin type. And also, what that tends to happen is because of the type of weather that we tend to be located. So let me give you guys a small history lesson. So no matter what genetics you may have or what origin story you may have, um, we all came from black people. We all came from black people. So we all were derived from black people. So a reality of living in certain parts of the world, regardless of anything, is that you will experience different things. So, for example, my weather in Portugal is different from the weather of people in the UK, and their weather is going to be different from people in Australia, and their weather is going to be different from people in Africa and from people in Sweden, and so on and so forth, because we have different weathers. And because of different weathers, because of different quantities of sunlight, the human body had to adapt and become lighter to be able to absorb more light, which then transforms that light into vitamin D, which keeps us functioning. And that also has to do with certain skin types. So normally when you're more around heat, so what that means is that you have hotter weather, humid weather, you normally tend to have more oilier skin. While if you are in colder places that have more snow and rain, you'll tend to have more drier skin. Combination skin came from the fact that people like myself live in Mediterranean countries that the weather is very much balanced, and you have normally two separations. You get colder months, you get hotter months. So the skin evolved to be able to kind of blend in between the two. So as a combination skin, you may find that you need to switch depending on the time of the year. But going back to the oily skin, normally they recommend double cleansing a lot often because you tend to sweat more as well. You tend to produce more sebum, and also skincare products and makeup products should be non-comedogenic and oil-free. But that is a it depends on the skin, because there's a lot of people that swear by adding oils to the skin, and they say that it makes them feel less oily. So up to each their own. This is more of a basis, not a typical straight up advice. Also, um, I recommend stuff like niacinamide and BHAs for oily skin, because you will be more prone to getting your pores clogged because of the high sebum production. And also, niacinamide is a really great ingredient to help control the excess of the sebum. Since we talked so much about combination skin, let's go right on to it. So, when it comes to combination skin, normally what it tends to mean for a large majority of people is that your T zone, by the way, the T zone is your nose, chin, and forehead area. That's why it's called a T zone, because it makes like a T, and then dry on your cheeks. Normally, people like that tend to have larger pores, they're prone to acne, and they're also prone to having uneven texture because of it. Combination skin could be bang spank in the middle, it could be combination dry or combination oily. So that means that you lean more towards the oily or lean more towards the dry. And some people may feel like in summer they have one skincare routine, and then in winter they have a different skincare routine to adapt to how their skin is feeling. What it tends to be recommended is to cleanse twice as well. It's not advised to use aggressive or drying products. Instead, it's supposed to be non-comedogenic skincare products and makeup. They also recommend stuff like retinol, niacinamide, and BHA. So, very similar to the oily skin type, be aware that you may feel like going towards the vitamin C and hyaluronic acid as well on the drier months. And of course, SPF, like I said, no matter what, you should use SPF. Then we have the sensitive skin type. I kind of don't agree with this being called a type because this is more like a condition normally. And it normally only becomes a type if someone has sensitivity very often. So normally you're more redness prone, the skin is more rough and have more uneven texture. You tend to have more irritations, you tend to have more allergies. And normally you need to find what causes it, cut it off, and then make sure that you have sunscreen and a good moisturizer to help it calm it down. So when it comes to skin conditions, okay, so types of skin problems or skin conditions tends to be stuff like acne, rashes, eczema, psoriasis, rosacea, large pores. So basically, it tends to be things that are temporary. So that's what a skin condition is something that is caused by factors that are not controlled. So, for example, another example is hyperpigmentation, compromised skin, like the skin barrier being compromised, dehydrated skin, um, and so many others. The way that you can go about taking care of these things is not only by, of course, taking care of your skin properly, but also figuring out what you need to take care of. So, for example, for aging and wrinkles, something that is very much recommended is retinol. Retinol acts by getting deep into the skin and basically exfoliate the skin and also heal the skin at the same time. Acne tends to be due to clogged pores or sometimes a bacteria present in the skin. Depending of the severity of your acne, you could go for just over-the-counter products, or if it goes into the levels of cystic acne and it causes you pain and all that, I would advise to visit your dermatologist and getting yourself probably either prescription medication or topical medication. That depends on the severity and what the doctor recommends you do. For hyperpigmentation, there's two, actually more than one type of hyperpigmentation. So hyperpigmentation, there's a couple of them. So you could see it in the form of melasma, freckles, sunburn spots, radiation spots, pregnancy spots, pimple marks, and even skin tones, so on and so forth. But normally the main one that people tend to see is either red or dark. So normally when it's red, tends to be post-inflammatory erythema, which normally has to do right after having a pimple. You normally have the like red spot, and then you um, also have the darker ones, which normally tend to be um, from old scarring, or if it's because of acne. One of the key here is, and I know this is not easy for people to hear, but it's to not pick at your acne. Picking at your acne can and most likely will cause for your skin to not only become irritated, but you could also make it worse than it actually started out to be. You build up an infection on it, and instead of it healing in 3 to 5 days, it can take you weeks to heal. And when it comes to, by the time that the dark spot is there, stuff like retinol, vitamin C's, and all kinds of acid, so acids that work on the surface of the skin. So there's two main kinds of acids, the ones that go into the pores and the ones that stay above the skin. The one into the pores are great for to pull the impurities out of the pore and to get all of that gunk out, which is great for people that have acne because it will help remove all the excess stuff in the pore, allowing for your skin to have basically there's like this purging that can happen when you use it, so it kind of gets worse before it gets better, but it allows everything to get out of the pore. And then you have the ones that work on the surface. Those ones will be great in the long run for hyperpigmentation, but you could also go for stuff like retinol to really hammer it in. Um, when it comes to redness and rosacea, those are technically two separate things. So, redness normally, when we talk about redness, is stuff like the post inflammatory erythema, so post inflammatory redness. That one is very easily treatable. Normally, we see it tone down, we see it go away naturally. It doesn't really bother too much, or sometimes people have a natural flushed face where they're not red all the time, it just kind of comes up. Rosacea in particular is when you have a patch of redness that never goes away, and it's normally noticeable because you almost have little red veins across your face. So that is rosacea. It's basically broken capillaries that come up to the surface of your skin and they become visible. Normally, that you have to be very aware of treatments, and you may find yourself having to do a dermatological treatment with either a topical or an oral medication. When it comes to dehydration, that's one of the easiest things to treat. You basically just need to find a moisturizer that works for your skin, and idealistically one that contains stuff like humectants and acids to help pull and maintain the moisture in your skin, using products to maintain the moisture barrier on your skin, and also using ingredients to help the water molecule penetrate your skin and give you better results with your skincare. So, I'm not going to recommend brands or products or anything like that because let's be honest, it's very much trial and error. I can tell you for myself, I used Korean brands, European brands, American brands. I used all kinds of brands throughout my life when it comes to skincare. Skincare is a very, very personalized thing. There's no one size fits all. You can have a skincare routine. There's all kinds of routines that people tell you, more complicated, less complicated, yada, yada, yada. If you want to have the most basic routine, no joke, most basic skincare routine. In the morning, you cleanse, you moisturize, and you put an SPF, idealistically 30 plus or higher. At night, once again, you're going to cleanse. You're going to do either a serum, a toner, an essence, or some sort of treatment, and then you do your moisturizer. That's it. If you want to add something like a weekly treatment, you could do like a mask or an exfoliant or retinol, but that's it. That is the most basic routine. How do you increase stuff to make it better? Of course, there's some sort of targeted serum at night, some sort of treatment, an exfoliation weekly, a mask, a retinol. You add that to create a more specified, targeted routine for yourself. But if you want to go basic, that's pretty much it. So I hope that this helps start out your skincare and helps you on your journey to give you a little push. If you guys like this kind of skincare content, I could go a little deeper. Maybe into the types of products, type of ingredients that you'd like that for each skin type. But for now, I want to start with something really basic and get you guys feedback on it before going further. I hope you enjoy your day and you enjoy yourself. Have a good one.
Don't forget to follow That Girl Magic to stay updated on new episodes. Let's unleash our inner magic and create the life of our dreams. I'll see you in the next episode.